Hi everyone, this is Dennis Durso, PGY1 Emergency Medicine Resident at Jackson Memorial Hospital, and in this video I will be demonstrating an ultrasound-guided intra-articular block of the shoulder. In this case, we had a patient with an anterior glenohumeral dislocation who failed reduction with anxiolysis alone using 2 mg of Ativan IV, so we chose to perform an intra-articular block to provide local anesthesia prior to repeat attempted reduction. This procedure involves guiding a spinal needle into the joint space and injecting about 20 cc's of 1% lidocaine to provide rapid onset local anesthesia to the entire shoulder joint, similar to the concept of a hematoma block. Alternatively, bupivacaine can be used alone or in addition to lidocaine to provide longer duration anesthesia. Ultrasound is used in this procedure to identify relevant anatomical structures, to guide the spinal needle tip during insertion, and to visualize spread of anesthetic agent throughout the joint. A lower frequency curvilinear probe is used to provide adequately deep penetration and wide field of view for this procedure. The probe is placed horizontally on the posterior aspect of the shoulder at the level of the scapular spine. In a normal shoulder joint, the humeral head should sit immediately adjacent to the scapular spine. In an anterior shoulder dislocation, the humeral head will appear deep to the scapular spine, farther from the ultrasound probe, reflecting anterior displacement, as we see here. Next, after numbing the skin with a wheel of lidocaine, a 20-gauge spinal needle is introduced into the joint space using inline ultrasound guidance. The needle is advanced at a 45-degree angle, which allows us to visualize the entire needle as the needle tip enters the joint space. As you inject, you should be able to see spreading of the anechoic anesthetic as it infiltrates the joint space. After a minute or two, the patient reported adequate anesthesia of the shoulder, and a second attempt at reduction using traction-counter-traction was quickly successful. The patient tolerated the procedure extremely well and felt immediate improvement in the mobility of her arm. In this post-procedure ultrasound, you can see normal alignment of the humeral head in the glenoid fossa and good range of motion upon internal and external rotation. There you have a successful ultrasound-guided intra-articular block.